Hi, good morning. I'm Sherina Jane Dulay, caregiver, and I'm going to do the care for nasogastric tube. It is a method of introducing a tube through the nose into the stomach. The purpose of the NGT is to feed the client with fluids when oral intake is not possible. It is also to dilute and remove consumed poison, to instill ice cold solution to control gastric bleeding, to prevent stress on operated site by decompressing stomach of secretions and gas. And also, it is to relieve vomiting and distension. When we're gonna do the NGT, we're going to need the following equipments. Nasogastric tube in appropriate size, a septal syringe, lubricant, cotton balls, kidney tray, adhesive tape, stethoscope, clamp, marker pen, and also we're going to need the steel tray and disposable gloves if available, and also we're going to use the moisture resistant pad. In doing the procedure, we need to check the doctor's order for insertion of the nasogastric tube. It is to clarify the procedure and the type of equipment required. So let's check the doctor's prescription. Okay. And then we're going to explain the procedure to the client. This is the explanation facilitates client's cooperation. Good morning, Sir John. We're gonna do the nasogastric tubing. This is to feed you with the fluids when oral intake is not possible, and also to dilute and remove consumed poison, to instill ice cold solution to control gastric bleeding if ever, to prevent stress on operated site by decompressing the stomach of secretions and gas. It is also to relieve the vomiting and distension. We do gather the equipments because organization provides accurate skill performance. Next is we're going to assess the client's abdomen. This assessment determines the presence of bowel sounds and amount of abdominal distension. Sir, I'm just going to check the sounds for in your stomach. Now we're going to perform hand hygiene. I'm going to do a hand rubbing. Hand hygiene deters the spread of microorganisms. It talks about sterile technique is not needed because the digestive tract is not sterile. Also, we're going to wear disposable gloves because it is available. These gloves protect us from the exposure to blood and or body fluids. Also, we're going to assist the client into a high founder's position of 45 degrees if unavailable to maintain upright position, because upright position is more natural for swallowing and protects against aspiration if the client should vomit. Next is we're going to check the nostrils of the patient. We're going to check the nearest for patency by asking the client to occlude one nostril and breathe normally through the other. We do this so that the tube because the tube passes more easily through the nostril with the largest opening. So, sir, can you please occlude the one nose and breathe to the other? Okay. Also, we're going to clean the ears by using the cotton balls. Next is we're going to select the nostril through which air passes more easily. Next is we're going to measure the distance to insert the tube. We measure the distance to insert the tube by placing place the tip of the tube at the client's nostrils, extending to the earlobe, and extend to the hip of the sepoid process. And then we're gonna mark the tube with a marker, pen, or a piece of tape. Measurement ensures that the tube will be long enough to enter the client's stomach. First, we put the resistant pad so that we can avoid the soiling of the linens. And also to provide comfort for the client. Also, we're going to put the kidney tray. And now, we're going to lubricant the tip of the tube at least 1 to 2 inches with water-soluble lubricant. The lubricant reduces the friction and facilitates passage of the tube into the stomach. We may not recommend to use the silocaine jelly as a lubricant due to the risk of silocaine shock. Water-soluble lubricant will not cause pneumonia if tube accidentally enters the lungs. Okay, this 1 to 2. Next step is we're going to insert the tube. So, insert the tube into the nostrils while directing the tube downwards and backwards, following the normal contour of the nasal passage. While inserting the tube reduces irritation and the likelihood of mucosal injury. So, the client may gag when the tube reaches the pharynx. The gag reflex stimulated by the tube. We instruct the client to touch his chin to his chest. Sir, can you please touch your chin to your chest? And also, we're going to encourage him or her to swallow even if no fluids are permitted. Sir, can you please swallow? Swallow. Swallowing helps advance the tube and causes the epiglottis to cover the opening of the trachea and helps to eliminate the gargling and the coughing. Advance the tube in a downward and backward direction when the client swallow. And stop when the client breathes. Okay, another sir, swallow. 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 If gargling and coughing persists, check the placement of tube with a tongue depressor and flashlight if necessary, because excessive coughing and gargling may occur if the tube has curled in the back of the throat. So, we're going to check if So, we're going to keep advancing the tube until the marking or the tape marking is reached. So, the marking is here. So, we're going to stop it. Please take note that do not force. Rotate the tube if it meets the resistance. Forcing the tube may injure the mucous membranes. Discontinue the procedure and remove the tube if the tube are signs of distress, such as gasping, coughing, cyanosis, and the inability to speak or hum. The tube is not in the esophagus if the client shows signs of distress and is unavailable to speak or hum. Sir, are okay? Okay. Next, we're going to keep one hand on the tube and verify the tube's placement in the stomach. We're going to do the aspiration of a small amount of stomach contents. We're going to attach the syringe to the end of the tube and aspirate the small amount of stomach contents we're going to visualize the aspirated contents and checking for color and consistency. The tube is in the stomach if its contents can be aspirated. We're gonna do the auscultation. We're going to inject a small amount of air into the nasogastric tube while I listen to with the stethoscope. We're going to put it approximately approximately 3 inches, about 8 cm below the sternum. So if the tube is in the stomach, you will be able to hear the air with a whooshing sound. If the tube is in the esophagus, injecting the air will be difficult or impossible. In addition, injection of air often causes the client to belch immediately. If the tube is in the larynx, the client usually is unable to speak. Next is we're going to obtain a radiograph of placement of tube as ordered by the doctor. Now we're going to secure the tube with the tape to the client's nose. Be careful not to pull the tube too tightly against the nose. A constant pressure of the tube against the skin and mucous membranes causes tissue injury. Next is we're going to clamp the end of nasal gastric tube while I bend the tube by fingers, not to open. Bending the tube prevents the inducing of secretion. This tube actually has this type of, so we can close it, but still we're going to use the clamp to the end so that we're going to prevent the inducing of secretion. After that, we're going to put off and dispose the gloves and perform the hand hygiene. It is to prevent the spread of infections. Now we're going to replace and properly dispose of equipment. It is to prepare us for the next procedure. After the procedure, we're going to record the date and time, the size of the nasal gastric tube, the amount and color of the drainage aspirated, and relevant client reactions. This documentation provides coordination of care. We're also gonna sign the chart for the accountability. After we do the documentation, we're going to report to the senior staff to provide the continuity of care. Next, we're going to do the procedure of administering a nasal gastric tube feeding. A nasal gastric tube feeding is a means of providing liquid nourishments through a tube into the intestinal tract when client is unable to take food or any nutrients orally. The purpose of it is to provide adequate nutrition to the client, to give large amounts of fluids for therapeutic purpose, and to provide alternative manner to some specific clients who has potential or hard swallowing difficulties. Next, we're going to need the following required equipments. We're going to use a disposable gloves, feeding solution is prescribed, feeding bag with tubing, water in jug, large catheter tip syringe or larger than it, measuring cup, clamp if available, paper towel as required, doctor's prescription, and a stethoscope. Check the doctor's prescription. Okay. Assemble all the equipments and supplies after checking the doctor's prescription for tube feeding. The organization facilitates accurate skill performance, and checking the prescriptions confirms the type of feeding solution, route, and the prescribed delivery time. So next, after we assemble all the equipments and supplies, we're going to prepare the formula. If the formula is in the type of can, shake the can thoroughly and check expiration date. Feeding solution may settle and requires mixing before administration. Outdated formula may be contaminated or have lessened nutritional value. So always take note to check the expiration date. In the type of a powder, mix according to the instruction in the package. Prepare enough for 24 hours only, and refrigerate unused formula. Label and date the container. Allow formula to reach room temperature before using it, because formula loses its nutritional value and can harbor microorganisms if kept over 24 hours. Cold formula cause abdominal discomfort or sometimes diarrhea. Other preparation of formula, if ever it is in the type of liquid which prepared by hospital or family at the time, make the formula at the time and allow formula to reach room temperature before using. So for the formula, we're going to use the type of liquid which prepared by the hospital. Next is we're going to perform hand hygiene and put on disposable gloves if available. We do hand hygiene to prevent spreading of infection. So, we're going to position the client with the head of the bed elevated at least 30 degrees angle to 45 degrees angle. This position helps avoiding aspiration of feeding solution into the lungs. Next is we're going to determine the placement of the feeding tube. We're going to do it by placing or attaching the syringe filled with air to tube. We're going to inject the air while listening to the stethoscope over left upper quadrant. We're going to hear a whooshing or gargling sound, usually indicated that the tube is in the stomach. We can also use an X-ray or ultrasound to determine the placement of the feeding tube into the stomach of the client. So now we're gonna do the intermittent or the bolus feeding using the syringe. So feeding the following, we're going to clamp the tube. Insert the tip of the large syringe with the plunger or bulb and remove the gastric tube. Pour feeding into the syringe. And then raise the syringe 12 to 18 inches above the stomach and open the clamp. The gravity promotes movement of feeding into the stomach. So we're going to allow feeding to flow slowly into the stomach. Raise and lower the syringe to control the rate of flow. Controlling administration and flow rate of feeding prevents air from entering the stomach and nausea and abdominal cramping from developing. Add additional formula to the syringe as it empties until feeding is complete. Termination feeding. Terminate feeding when completed and instill prescribed amount of water. So we're going to put the water into the measuring cup to instill the prescribed amount of water to be given to the client, and keep the client's head elevated for 20 to 30 minutes. It is to maintain patency of the tube, and elevated position discourages aspiration of feeding solution into the lung. After the NGT feeding, we're going to provide mouth care by brushing the teeth of the client. And also, we can offer a mouthwash and keep the lips moist. Mouth care promotes oral hygiene and provide comfort to the client. Can you open your mouth? Mouthwash. Let's put petroleum jelly or a balm to prevent from drying your lips. Next is we clean and replace the equipment to proper place. It is to prevent contamination of equipment and prepare for the next procedure. Next is we're going to remove gloves and perform hand hygiene to prevent the spread of infection. Next is we need to document the date, time, amount of residual amount of feeding, and the client's reaction to feeding. The documentation provides the continuity of care, and we also need to sign a chart because giving signature maintains professional accountability. Next procedure is we're gonna do the removal of a nasal gastric tube. So first, we're going to assemble the appropriate equipment such as the kidney trays, the tissues or a gauze, and also disposable gloves at the client's bedside. Organization facilitates the accurate skill performance. Next, we're going to explain the client what are we going to do because providing explanation fosters cooperation of the client. Next, after that, we're going to put the gloves. It is to prevent spread of infections. Next, we're going to remove the tube. We're going to take out the adhesive tape, which holding the nasal gastric tube to the client's nose, and we're going to remove the tube by deflating any balloons. Next is we're gonna remove the tube. First, we're going to take out the adhesive tape, which holding the nasal gastric tube to the client's nose. But I'm going to use the cotton balls with distilled water to remove the tape so that it will so that the client will not feel discomforted while removing the tape. Remove the tube by deflating any balloons. Do not remove the tube if you encounter any resistance, and do not to harm any membranes or organs. Do not do another attempts in an hour. Simply pulling it out slowly at the first and then rapidly when the client begins to cough. Continuous slow pulling it out can lead cough or discomfort. After that, we conceal the tube. Be sure to remove any tapes from the client's face. Acetone may be necessary. Acetone helps any adhesive substance from the face. You should also wipe the acetone out after remove tapes because acetone remained on the skin and may irritate the skin of the client. If needed, we provide mouth care. It is to provide comfort for the client. Next is we're going to put off the gloves and perform hand hygiene. It is to prevent the spread of infection. Next is we're going to dispose the equipments and replace them to prepare for the next procedure. Next is we're going to record the date, time, and the client's condition on the chart and be alert for complaints of discomfort, distension, or nausea after the removal of the nasal tube. So, documentation provides the coordination of care. Also, we're going to sign the signature because giving signature maintains professional accountability. After we do the documentation, we're going to report to the senior staff to provide continuity of care.